Welcome to Wonder Hair Career Institute Online. My name is Levina and I'll be your instructor for today. And today we're going to talk about partial bed bath and back rub. We are going to start at looking at the checklist. On the day of their exam, the instructions might read this way. You are asked to bed a resident who is in bed and who is not able to help with his or her bedding. You are asked to wash just part of the body so that technique can be evaluated. You are asked to wash the resident face, neck, back, one hand and arm, and the chest and abdomen. Soap and water should be used for this skill. The resident also need a back rub. When completing this skill, the mannequin is dressed in a clean hospital-style gown. Again, this skill is mannequin skill. Now let's start by going through the checklist. Of course, we know our indirect skills, and we're going to start on number 3 in our checklist. It says use water of safe temperature for washing and rinsing. I have said this in the previous videos. Any skill that requires water, you have to check the temperature, and you must ask your residents to check the temperature of the water. Clean eyes by using soap-free washcloth, wiping eye from the inside corner to the outside corner, changing the clean area of washcloth before returning to inner corner and before cleansing the other eye. Meaning you must change the corners of your washcloth when you are cleaning the eyes. So on this partial bed bath, you start by cleaning the eyes. Start from the inner towards the outer. And each time you must change the corner of your washcloth. Wash resident face using soap-free wet washcloth, unless a certain resident preference to use soap before washing face. Leave face dry after washing. Contain corners of washcloth while washing and rinsing. If you're going to clean this patient face, remember there is no soap unless the patient says she wants soap. And when you're cleaning this face, you want to make sure that the washcloth is not going everywhere on that face. Example, if you're cleaning the eyes, you want to make sure the other part of the washcloth is not hanging everywhere. You're cleaning the face, you make sure that where you're cleaning is where that washcloth is touching. You don't want the washcloth to be going everywhere on that person's face. Protect bed linen from becoming wet during washing and rinsing of body, meaning the non-face. You remember you have to put towel under the person's head and towards the arm where you're going to wash. This, you are protecting that linen from getting wet. Wash resident body, that is the non-face, using a wet washcloth with small amount of soap. Use clean soap-free wet washcloth to remove soap from resident skin. When you wash the face, remember you didn't use soap, so there is no need to rinse. After washing the face, you have to dry. But when you are washing other parts of the body, you have to use soap. And remember, whenever you use soap in washing, you must rinse. And after rinsing, what follows? Drying. Wash and rinse resident neck, hand, arm, chest, and abdomen. Dry neck, hand, arm, chest, and abdomen. Support arm if raised off bed to wash. rinse and dry the back side of arm. Assist resident to turn onto side before cleansing back. When you're washing the resident, remember we're just evaluating the technique you are using. You have washed the face, you dry. You start with back of the ear, you walk down to your neck, the chest area, under the breast, abdomen. When you come to the arm, I advise start from the tip of the fingers. You start walking your way up this way, walking your way up this way. And here, which is the armpit, supposed to be the last part you will clean. This is the last place you will clean. Now, if you start back and forth motion to clean this hand and the arm, you might make that mistake of cleaning here and going back here. So start from the tip of the arm and walk yourself up. When you get to the armpit, this is the last place you wash, and then you dump the washcloth. The same way if you are rinsing. And when you are washing this hand, remember you have to support this arm if it's off the bed, please. Now you have finished the face, the front, now you have to wash the back. Assist resident to turn onto side before cleansing back. Wash, rinse, and dry the back. Replace basin of water during tasks if it becomes cold or soapy. Warm lotion before applying to resident back. Now, warming lotion, how do you warm it? There is no microwave, in the testing room. You put this lotion on your hand, palm, and rub it. This meaning warming the lotion. Use lotion to provide back rub with a long gliding and circular motion. Place clean hospital gown on resident and secure gown in the back. Now, when you're doing the back rub, you start from the back and walk yourself down 3 times. Okay, you do it the first one, go back 3 times. When you finish, just remove excess lotion. After you finish this massage, remove excess lotion, put back a clean hospital gown on this patient. Of course, we know what next to do. Make sure the bed is positioned on the low position. Make sure you give your patient call light. Tidy up your workspace, and then your skill is complete. This skill is not hard, it's just the way we think. And some people ask, it's so funny, why can't we go wash the other side? Remember, in real life, you're not going to do partial bed bath on just one side of the patient. What we are doing in the skill or the testing is just we're evaluating the technique you are using. It's not a partial bed bath, you're going to wash only one part of the patient and the patient will go with the other side. Please, I get that kind of funny questions. So let's go and talk about few questions. A nurse is giving a resident a bed bath. Which of the following should the nurse aide do during the bed bath? Keep the bed in the lowest position throughout the bedding. Keep the resident body covered during the bed. Open the window for fresh air during the bed, and a lot of soap to the water in the basin. I hope you will answer this question correctly. Are you going to keep the bed in the lowest position before, during, or after? It should be after the skill. During your ski, you want to keep that bed on a safe walking height so that you will not bend too much to, you will hurt your back. The answer to this question is keep the resident's body covered during this procedure. Remember your bed blanket. Miss Jones, you are covering Miss Jones with bed blanket for what? To keep her warm and for privacy. Another question. Before assisting a client into a bed or shower, the nurse aide should first check the temperature of the water, shampoo the client's hair, soak the client's feet, apply lotion or oil to the client's skin. I mentioned it earlier. Anytime you are using water for your patient, you must check the temperature. And again, your patient has to check it before you start using it. So the answer is check the temperature of the water. When giving a back rub, the nurse aide should 1. Apply lotion to the back directly from the bottom. Keep the resident covered as much as possible. Leave extra lotion on the skin when completing the procedure, or expect the resident to lie on his or her stomach. Again, you make sure you cover your patient. You're going to apply lotion, yes, but are you going to apply lotion directly from the bottom? Remember what we said when we were applying lotion, that you have to put it on your hand and then warm the lotion. Please don't make that mistake because you see lotion. You jump at it and say, yes, this is the answer. Read in between lines. When a resident refuses a bed bath, the nurse aide should do what? Offer the resident a bribe. Wait a while and then ask the resident again. Remind the resident that people who smell don't have friends. Tell the resident that nursing home policy requires daily bathing. Which of these options make more sense to you? Are you going to offer bribe to a resident so that she can take a shower? The answer is wait a while and then ask the resident again. Why? I don't know the shift you're going to work on that day. If you are on morning shift, you resume shift at 6 o'clock. I know you want to do your things so fast so that you can, do as much as things you can do before breakfast. Now you go to your resident's room to wake her up to take a shower at 6 o'clock, 6:10, 6:15, 6:30. Not everybody would like to get up at that time to take a shower. If your resident said no, try again later. Maybe it's too early for her to take a shower. When you ask your resident, she said no. Come back again later, she said no. Then you can tell the nurse that she refused. Again, twice. Then the nurse can go and ask the resident for shower. And then if she refuses, that means she doesn't want it. When providing food care to a resident, it is important for the nurse aide to do what? Remove calluses and corns. Check the feet for skin breakdown. Keep the water cool to prevent burns. Apply lotion including between toes. Yes, you might be asking yourself, why are we having question on food care when we're talking about partial bed bath? Remember, we did food care as a separate skill. When you are giving your partial bed bath or full bed bath, you're going to wash the foods also. So if you are doing your partial bed bath and you're washing the food, what are you supposed to do? Are you going to remove the calluses? Are you going to check the feet for skin breakdown? Are you going to apply lotion in between the toes, or are you going to keep the water cool to prevent burns? The answer is check the feet for skin breakdown. You're going to apply lotion on the foot, but not in between toes. You are not supposed to apply lotion in between toes. Thanks for watching. I hope you enjoyed these little tips. If you do, please subscribe and hit the notification button. Good luck in your exams. Thank you.